This year, I've been working on my senior honors thesis entitled Maternal Healthcare and Women's Control, Defining Priorities for Care in the Rukwa region of Tanzania. Earlier last year, I had done research while studying abroad in Switzerland about how organizations such as the United Nations and the World Health Organization define the global standards for what constitutes good maternal health care. Ultimately, I found that most women's role in that decision-making process is extremely minimal, and often the practices set in place by the UN and the WHO are not realistic on the ground in certain settings. One such setting is the Rukwa region of Tanzania. The region, one of the poorest in the country, is in the southwestern corner of Tanzania and has some of the poorest health outcomes. Education is relatively low, and most people live on less than $1 a day. It may seem like a given to us in the United States that most people give birth in hospitals that are fully stocked with life-saving supplies and motivated healthcare workers. In Rukwa, though, hospitals and equipped health centers are few and far between and difficult to get to on dirt roads that flood seasonally. Because international maternal health guidelines often don't hold up in these conditions, I was interested in interviewing women about their priorities for care to find out more about how the resources they do have can be leveraged most effectively. I also wanted to find out about whether women in the area feel that they have the agency to change the aspects of their care which they're not satisfied with. With my research mentor, Dr. Adrienne Strong, who's fluent in Swahili, I was able to write questions about women's control over their maternal health, family planning, and what they would change about the care if they could, as well as where they thought they could access the best care. We were able to interview 21 women in the towns of Sumbawanga, Namanyere, Kasanga, and Songambele Azimio. All of the interviews were done in Swahili and translated and transcribed later. The main problems, according to the women we interviewed, were that there are not enough beds, equipment, medication, and healthcare workers. They also expressed that corruption is widespread in the healthcare system, and some even fear the healthcare providers. Family planning information and services are also becoming more necessary because of high birth rates, coupled with the fact that the experience of pregnancy is largely seen as a woman's responsibility. That said, myths about the harmful effects of contraceptive methods, differing traditions about how many children to have, and the need for a husband's presence in order to receive care at low costs can deter women from seeking that information. Ultimately, most women said that although they often consult their husbands, they can make independent decisions about maternal health care. In terms of making more infrastructural changes to better care, however, there's less that can be done because of the deep-rooted financial barriers and lack of motivated healthcare workers.